Okay, this video is how much do coronary artery stents and open heart surgery cost? CABG is coronary artery bypass graft, which is to bypass from the ascending thoracic aorta to the coronary artery to bypass a narrowing, a stenosis, a blockage. Anyways, according to this one site, and there's a whole bunch of them, you could just type this into your internet browser. How much do stents cost? How much does heart surgery cost? And they're pretty standard. You'll find a whole bunch of sites. They all tell you about the same thing. I've heard the same thing from Dr. McDougall and from others and from other doctors. So basically, angioplasty, inflating a balloon in a coronary artery with a drug-eluting stent, sort of one of the more popular modern stents, they say bills an average of about $50,000 here. And then the question is, what is the patient's copay? And they said the patient's copay, if they have insurance, can be anywhere from $1,500 to $7,000. Other sites will say $12,000. But what I'm trying to make the point of, this is a procedure with no benefit compared to the diet. You run the risk of having a stroke, of dying on the table with a stent, when you can easily go low-fat vegan and prevent and reverse heart disease. Why mess around with a stent? Low-fat vegan, it works better. It's free. So anyways, that's the first slide. I'll just show you. Here's sort of, typical slides. Here's one that says out-of-pocket cost for the patient. This one's called the Insurance Curator site on the cost for these different types of medical procedures. So total cost of procedure, billing about $40,000, they say. Patient out-of-pocket cost, including in a guy with insurance, $12,000. So you got to pay $12,000 for a procedure that doesn't even help you, when you could have gone for, and I'm talking in the context of chronic angina. If you have an acute myocardial infarction, it could save your life, but that's a rare event. Chronic angina is common. Okay, now here's just one about, comparison with open heart surgery. This is this Bowie site. There's tons of these sites that give you the price quotes, and they're all about the same. I went to a whole bunch of them. And they also are consistent with what I've heard in the past. So they're saying like a typical big-time medical center like UCLA, the billing is anywhere from $65,000 to $180,000. Cleveland Clinic, about $47,000 to $130,000. I actually think these numbers are underestimates because they're giving you the hospital costs. There's a bunch of additional costs. There's the pre-op workup, then there's the post-op physical therapy and whatnot. It's more. These are underestimations, okay? They say typically CABG, coronary artery bypass graft surgery, will take 3 to 6 hours, and then the hospital stay will typically be 5 to 7 days. Yes, that's true. That's true. But, you also have the risk of multi-organ failure, death, postoperative atrial fibrillation, postoperative cognitive impairment, all these major complications, postoperative kidney failure, when, what's the complication of low-fat vegan diet? None. And it's free, and it works much better than CABG. So, these for, CABG for coronary artery stenosis is totally overrated. Okay. Don't get me wrong. Heart surgery can save your life for valve disease because it's hard to improve that. You can improve anything with the low-fat vegan diet quite often, but, it's hard. You can open up coronary arteries or at least get them reasonably functional pretty well with the low-fat vegan diet in most atherosclerotic chronic situations. It's harder to fix a valve. Anyways, hope that was helpful.